Hello and welcome everyone to this webinar from ACAPS and the Humanitarian Leadership Academy, where we are focusing on the capacity strengthening needs in the non-governmental controlled areas in Northwest Syria, more localized approach. What we have tried to do through this analysis is to explore the capacity strengthening needs of local non-governmental organizations, headquarters and registered in Turkey, and the local responders which are operating in the non-government controlled areas of Northwest Syria. The capacity strengthening needs, they have been categorized based on the 3 strategic pillars of the Humanitarian Leadership Academy, which we will cover in more detail a bit later in the webinar. What we've been trying to aim for in this analysis is to inform the international humanitarian who rely on this localized response. We are not trying to come up with any solutions, just to highlight the capacity strengthening needs of them, so that any further action and any solutions can be discussed. What we will do first is to introduce these 2 organizational entities. Then we will cover the key findings. Then we will follow up to discuss some of the suggested solutions to the challenges that this analysis found. And we have also set aside some time towards the end for questions and answers. Take the next slide, please, Ruth. Thank you. Now, ACAPS, just to go a bit back in history, originally meant assessment capacities projects. And when ACAPS was founded in 2009, we mainly did field assessments and capacity building. We moved away from that a number of years ago. Today, our core activity is analysis, but the name is very well established in the humanitarian sector, so we kept it. We have as our vision and slogan that we want to see the crisis and change the outcome. We do believe that humanitarian action must be driven by a very clear and evidence-based narrative. And we are founded on the belief that data and analysis can change humanitarian outcomes. We do believe that you as humanitarian responders will make the best possible decision, the better analysis you do have. So our analysis is independent from any specific operational, political, or sectoral agenda. We deliver holistic analysis based on all the information we have available, and we're trying to support NGOs, UN agencies, donors, and the whole humanitarian sectors in a way so they can make better decisions. Take the next one, please, Ruth. Now, the Syria and Turkey earthquake project was founded just after the earthquakes back in February. And to begin with, we focused a lot on the life-saving analysis to inform the immediate response. After a couple of months, we started focusing more on thematic analyses, provided analysis that probed a bit deeper into the context. We ended our operational phase the 30th September, but we are now in still up and running and trying to find some new projects for a more longer-term engagement. Our last publication was done in cooperation with the Humanitarian Leadership Academy, and this is the one that we are here to present today. And on that note, let's hear from the Humanitarian Leadership Academy.
Hello, sorry, can you hear me?
Yes.
My apologies, math is low. My internet just dropped. So I'm going to talk a bit about the Humanitarian Leadership Academy and about who we are and what we focus on. And the Humanitarian Leadership Academy is an organization that's hosted or sits within Save the Children, within the Save the Children movement. And we've worked really closely with ACAPS, both as Humanitarian Leadership Academy, and I know they do a lot of analysis for us in regions like the ESSA region, especially even with this Sudan crisis. So they're really key partner, especially when it comes to identifying need. And I'll speak a bit about what we do. If we can go to the next slide, please. So our vision is a world where everyone has capabilities to handle crisis, ultimately saving lives. And I'll talk a bit about our structure. We recognize that a lot of the crisis affected countries sit in the global south. So we are trying to see how can we be closer to the crisis and be able to respond to emerging needs. We really cut across the globe with our Kaya platform, which I'm sure you've heard about, which is an online platform with learning on it, but as well as face-to-face trainings. We can go to the next slide. So I think just in line with what Rolf was saying, as they identify the need, we are recognizing that the humanitarian needs are increasing exponentially. I mean, if we just think of the past 2 years, we have the Ukraine crisis, we have the Sudan crisis, we've had the earthquake in Afghanistan, there's the OPT right now, and the growing number of people requiring assistance is really increasing. And what our mission is to enable people to prepare for and respond to crisis in their own countries. And we do that through learning. So we recognize that probably previous humanitarian modules had experts who'd come to where the crisis is and probably leave, and mostly international staff. Well, there's a role for them, but we are looking at how do we ensure that we're upskilling or tapping into the capacity of local organizations and local actors. So the next slide, please. So in terms of how we are organized, we sit, the head office, in quotes, sits within the UK, and we have a huge team in the regional centers and in the head office, or the main global office. We are staff of about 90 or so, but within the regional centers, we are about 26 staff. So how we are organized is we have a whole programs and learning team with learning solution specialists who are subject matter experts. They're experts in adult learning. So they do learning all the way from design to evaluation based on the needs that we identify. And we identify needs through different avenues. That could be through learning needs analysis. Some of the analysis like ACAPS would do, needs assessments, and so on. So within the programs and learning team, we have dedicated digital learning solution specialists who come up with digital formatting, digital development of our content. And then we also have the learning solution specialists who now deliver from face-to-face to online webinars. So I think that's the main team I'll zero into, because the regional centers sits under the programs and learning team. So we are established in 6 different regional centers. We are in Asia, we're in Eastern Europe, Middle East and Northern Africa, East and Southern Africa, West and Central Africa, Latin America, and the Caribbean. So this is where the centers are embedded, and you'll have the main staff based from the regional centers there. So like in LAC, we have someone in El Salvador, in Peru and Guatemala. West and Central Africa, the base is in Senegal, Nairobi for East and Southern Africa, Jordan for Middle East, Poland for Eastern Europe, and Asia, while the office is in Thailand, we have people across from Philippines, Georgia, Nepal, and so on. So I wanted to demonstrate how we are organized, especially our learning solutions specialists in those centers, where they deliver training based on the needs. So we can go to the next slide. Thank you. As I've just spoken about, we're looking at local actors as critical fast responders. Instead of bringing in international expertise, how are we ensuring we're strengthening the capacity or amplifying existing capacity, because we believe that local actors have essentially been the first responders. If you think of areas where there is lack of access, but we're seeing how do we ensure that we are building that capacity, including technical capacities, and I'll speak about our different pillars. So we can go to the next slide. So we work under 3 pillars, which I'll talk about, but in terms of our areas of focus, we look at the individuals, and by individuals, you have people enrolling into our trainings, and then at organizational level, we're looking at organizational strengthening. OCD is an area we're really growing in at the moment, and we're just looking at how we can impact the wider humanitarian sector. So we're working very closely with networks like GNDR and NIA, and just trying to explore how do we influence the humanitarian sector when it comes to learning, but also our localization ambitions. We can go to the next slide. So we have 3 key strategic pillars. So as I said, we focus on individual, organizations, and sector, but we fit our programs within 3 key strategic pillars. So we have the leadership pillar that looks at promoting diverse and inclusive learning to build a pipeline for local leaders. And we have some programs on that. There's a program, for example, called Field, that we build operations and leadership capacity. We have programs like Humanitarian Operations, which is an entry level for young and next generation humanitarians to be able to come into the sector. Then we have technical expertise, which is essentially those topics that cover service provision within a crisis. So, for example, there's education in emergencies, we have child protection in emergencies, mental health and psychosocial support in emergencies, public health in emergencies. So building that technical expertise. And again, as we said, local actors are at the heart of it. So we work here with clusters and technical working groups, but we also work very closely with local NGOs to upskill them, and also governments. And that works across. And the last one is civil society strengthening, where we're looking to build the capacity of local actors, that's government, non-state actors. There's an example of East and Southern Africa. We've been able to do that. And also OD, just sharing different organizational capacity assessment tools that our local actors use to assess their own capacities and come up with their own capacity strengthening plan. And where they request our support, then we come in and we're able to support them on that. So those are our 3 key strategic pillars: individual, organization, and sector, and looking at localized leadership, technical expertise, and civil society strengthening. And I think it would be good to just emphasize that at the heart of it is localization and working with local actors and locally led action. So there's a lot of capacity sharing and joint development of content. We can go to the next slide now. And I think I'll hand over to Budo so she can just talk about a bit about how the MENA Center is organized, because this study speaks directly to the Syria response. And I'll hand over to you, Budo.
Thank you, Nancy.
I don't know if I introduced myself. Maybe I can again. Nancy Muretti. I'm the head of the regional centers, and I mentioned that there are 6, and I'm based in Nairobi, and it's lovely to meet you all here. Over.
Thank you, Nancy. So welcome, everyone. My name is Budur, and I work as a regional lead for the Middle East and Northern Africa Regional Center for the Humanitarian Leadership Academy. And now I just want to give you a short overview about what we have been delivering in this region from the beginning of 2023. So when we talk about the Syria context, so ever since the earthquake happened in February, we started to respond as we do with any other emergency by, first of all, by delivering our online resources. Nancy mentioned that we have the Kaya platform, which has a lot of courses in Arabic language that can be also beneficial to the respondents. We have also the Response Hub. The Response Hub is also a platform that has all these short courses that can upskill any people who are working in the field, and they want like to have this a quick upskilled in certain areas that are very important. We have been working on a lot of translations to Arabic and also uploading them to the Response Hub. This Response Hub was shared with different partners, with different stakeholders, to make sure that everyone has access to this Response Hub, so they can also learn whenever they want using this asynchronous modality. Now for our trainings, we since May, we start to have a lot of consultations and meetings with the local partners to identify what is the exact needs for them at that stage. So one of the recommendations we received from the partners that they would prefer at that stage during May and June, that like to have this remote facilitation sessions. And some of the topics that were identified by the target audience was like to have more sessions about staff well-being, especially at that critical time, and also more about safeguarding and more about coaching and mentoring. So we delivered 3 remote facilitated sessions in Arabic for our target audience. And then later on, we started to develop these face-to-face trainings. So we delivered a face-to-face training in Ghazi Antab in July. It was about education in emergency, and this training was in Arabic. It targeted the local partners, the local organizations. It was also in coordination with the education cluster. What's really nice about this course, and I will talk about it in the next slide, that it was really co-created with the local partners in terms of the content, in terms of the delivery, and so on. We also delivered another types of trainings. We have the HOP training, which Nancy mentioned before, which is the Humanitarian Operation Program, which is under the leadership pillar, which aims also to improve the capacities of people who are new to the humanitarian sector. And also we had some training regarding the CAS, which is accredited by University in Geneva, also to upskill our participants in the education in emergency. We have also done some work in Yemen. We have delivered also 2 education programs in Arabic in coordination with the education cluster and the government, one in Sana'a and one in Aden. And also we conducted a TOT for the local Yemeni organization on how to, to be able to use the organization capacity assessment tools. So this is in a nutshell of what we are doing. We are planning also to deliver a series of training in the upcoming months, and I will explain about these in the next slides. Thank you so much. Over to you.
Thank you. If you can start with the first key finding, getting back to where we started about this analysis that ACAPS did together with the HLA, we have now 6 key findings that we want to focus on. The first one is that the earthquake response, it showed clearly how the grassroots organizations that are based in Northwest Syria are way faster and more capable of mobilizing resources to respond to disasters and crises like this. That dynamic is not unique for Northwest Syria. It's the same as you see in many sudden onset disasters around the world, that when it strikes as surprising and sudden as an earthquake can be, it's the local responders who mobilize and make the biggest difference in the first phase. The reason in Northwest Syria is because they enjoy greater autonomy in decision-making and access to flexible funding, such as diaspora donations, compared to those who are more heavily relied on NGOs and UN funding. The NGOs and local NGOs that relied on the offices in Turkey for coordination and support, including consultations, needed to plan responses, and having that approved and the strategy, then they were way slower at mobilizing. Even if this is not unique, it also showcases how important it is to prioritize these locally led initiatives. Take the next one, please. The capacity of organizations, as well as the availability of and the access to various capacity strengthening needs, depends very much on the location of their office or the staff. What we see is that the representatives have offices in Turkey. They have way greater capability to access capacity strengthening opportunities than the local responders inside Northwest Syria. The ones who have the offices in Turkey are both stronger and have better access to all that is offered. There's of course a element of safety and security here, and the lack of access into Northwest Syria from Turkey that plays a huge role. But this hierarchy applies when we analyze the capacity strengthening opportunities that are available in Syria, where the values and standards of international responders are sometimes pushed down towards local responders through very much a top-down approach, delivering pre-tailored training courses. Take the next one, please. Most operational capacity trainings, they have been focused on managing and reporting on a specific grant, and it often lacks that longer-term vision where we try to support organizations in their fundamental functions, such as project management, leadership, data management, etc. The organizations who receive the training also lack support to improve the training they've been giving in terms of sustainability, such as developing policies, procedures, and systems. And this is actually a recurring challenge for many localization initiatives. And we're trying to break this cycle where local partners actually become true partners and move away from them being viewed as implementing partner as they were very much in the past. It becomes very much the business as usual, and from the international NGO community side, they are often caught between the rock and the hard place, where the donor requirements on everything from due diligence to reporting requirements many times takes the front seat when it comes to working with partners, and is actually not helpful in forming an equal partnership. Take the next one. The grassroots organizations, the ones we mentioned initially, especially those that are led by women and youths, they often feel like they're trapped in a vicious circle. They do not have access to the capacity building offerers at the same level as those who have offices or representation in Turkey. They don't receive donor funding, and it becomes a vicious circle because they cannot access it because they don't have that connection in the first place. The locally led initiatives, they require local responders to identify their capacity needs so they can better design and implement projects. Some of the needs that these locally led initiatives have identified, it includes resource mobilization, how to fundraise, how to monitor a budget, logistics, and procurement. But these locally led initiatives, they require more equitable partnerships achieved when international humanitarians invest more in local responders. They share both knowledge, power, and also decision-making throughout the project cycle. We need to break this business as usual, as I mentioned in the previous points. And finding a way of breaking this and getting away from this and establish these true partnerships with locally led initiatives is where we need to invest in capacity strengthening, and it needs to have a very clear handover and exit strategy as an end vision of this. The strengthening of the local leadership is crucial to this, because you need to promote the inclusion, community engagement, then reduce corruption, nepotism, favoritism, and this. And these are the things that you need to work with if you were going to bring the capacity strengthening in Northwest Syria a step forward. Together with me today, we also have Bassam Kazumi, who are the main researcher on this study. And I don't know, Bassam, if you have anything you want to elaborate on these key findings at this stage.
Thank you very much. Thank you all, and thank you all for joining us today. And special thanks to everybody who contributed to this research, directly or indirectly. So yeah, I think just to give you a little bit of a summary, initially we were looking for capacity strengthening needs post the earthquakes in Northwest Syria. But given like there has been a lot of changes on the ground, the UN Security Council cross-border resolution really affected this research of how we were asking people, like, how is the reality is going to change for them after this resolution? What kind of new work modalities needs to be basically rolled out to local organizations? And initially we were interviewing people in Turkey, but again, we had to start from scratch in terms of what does localization means? What does it mean for organizations in Turkey? What does it mean for organizations inside Northwest Syria? And what does it mean for local grassroots organizations that work on a very, very grassroots level? And again, localization means for donors and funders as well. So it was a bit of an ambitious start from the beginning. We had limited time and resources. So this research is just the beginning, really, to ask what kind of capacity needs to happen, or what kind of strengthening we need to give to these local grassroots organizations when there is like a massive disaster happening. Who mobilized first, who had the flexibility, who had flexible funding to actually support these local initiatives. The most important thing that came out is we can actually rely on pre-existing capacities on the ground, so it is possible. So that was a very, very good finding from this research. And again, the methodology, and I really, really encourage everyone to go and read the report. I adopted a participatory action research methodology, specifically because I'm based in London and I'm not on the ground. I did not lead any kind of humanitarian response to this crisis. So I had to give flexibility to this research. So the research question really changed. The approach really changed. I was fully aware of my powers, fully aware of my knowledge. I did work on this area humanitarian response, so I already had some knowledge beforehand. But again, the idea is localization can be implemented by everyone, including me as a researcher. So it means that I need to give power and space to the people on the ground who are actually leading this kind of work to shape this research. Otherwise, I'm just in an echo chamber. So yeah, again, localization can really be implemented by everyone, including grassroots organizations. So this research really focused on the very grassroots, the very last bit of this funding channel. And the findings, as Rolf has mentioned, are quite, some of it makes sense and we've heard it before, but some of them are actually new, and we learned something about what happens when a disaster strikes, like the Northwest Syria context is quite specific because like you have representation offices in Turkey who has the power to actually mobilize funding, mobilize resources. But because the earthquake really affected Turkey as well, so these offices were not really engaging on the ground. So it was the grassroots organization who had flexible funding, seed funding. And this is part of the solutions that we kind of like did not really expand on, but like there was something already happening that we thought that could actually help. And there was a lot of similarities in those two. So that's really, really in a nutshell. I'm sure you all have questions, so I would really do my best to answer some of them.
Thank you, Bassam. We will dedicate some time to at the end for questions and answers. And but before we start questioning and discussing those needs, let's hear from Budur and HLA again on some of the suggested solutions they have to the challenges we identified. So Budur, if you are ready.
Yeah, thank you, Ralph. So for us as HLA, this research was very beneficial for us. So it will help us whenever we are planning for our next initiatives and capacity strengthening activities. We make sure that these activities are really relevant and they are really useful and feasible. So I advise every stakeholder who is working in this context just to look and read the research carefully and draw from it what are the next steps. So for us in HLA, we always try to have different modalities of capacity strengthening. So we do not only rely on the traditional face-to-face workshops only, but we also suggest other ways of capacity strengthening. So we do a lot of remote facilitation, especially when there is some challenges with access, maybe some legal issues for some participants who cannot attend because maybe they don't have the registration or maybe the right to attend. Also, we have some other initiatives such as coaching and mentoring, especially when the staff, they are really very busy. They don't have time really to attend these long workshops, and they want to have this quick fix of capacity building. So maybe they can have some coaching and mentoring based on their needs, and it can be more customized to their own vision as well. We also have our online resources, which we can all the time offer for anyone who really need to have upskills in their own skills. So there is a flexibility for different targeted groups. So we do not only stick to one modality of capacity building. We accommodate different modalities. There is also have been some discussions about secondments. So we saw in the report that some organizations, they are really interested in this approach. So we are also discussing the idea of having secondments within the region or within also other regions. So this is also something we are discussing in the HLA. Also, when we are talking about barriers to attending the training face-to-face, in HLA, we always try to adopt the model of TOT, where we build on the capacities of local experts, and then these local experts, they can cascade their trainings later on in their own context. So I will give you an example, which we done, and it was very successful, and we are planning also to do later on. So we have a program called the Certified Advanced Study Course. It's for the education in emergency, where we train a pool of facilitators who are experts in education in emergency, and then they are equipped with the skills to cascade this training in their own context. So we did it for some of our colleagues, and they were able to deliver this training inside Syria in a very successful way. Also, whenever we are doing any intervention, we make sure that we do a lot of consultation with the partners, with the target group. We make sure that we do the LNAs, and we also make sure that whatever intervention we are applying, it's really based on the needs. We do this through a lot of coordination, through a lot of discussions, just to make sure that it's really something that is useful to everyone. And whenever we are promoting any capacity building initiative, we make sure that we give a priority to the local organizations and to make sure that there is a clear criteria. So if you read in the research that sometimes you can see the same faces over and over in the trainings. So it's very important to make sure that we share these capacity building initiatives to the wider sector through the forums, through the clusters, to make sure that even organizations that are not always attending this training, they are also able to attend these trainings as well. And we have a clear criteria for each of these capacity building initiatives. Next slide, please. And when we talk about localization, we really care about the language. As you know, we have been doing a lot of work around the translation into Arabic when we are talking about the content and also the facilitation. And whenever we facilitate, we always rely on the local experts as well. So like what we did, for example, with the education emergency program, we did it in collaboration with our local experts who also guided us on, for example, this topic is related to the context, or this topic is a priority or not. And based on the findings from the report also, it's very important not only to focus on the technical topics like child protection, humanitarian principles. These are very important, but as well as to focus on the operational capacity of the organizations. So we are planning to deliver a lot of training programs about meal in emergency, for example, about leadership, and also about project management. So we make sure that we focus on different aspects of the capacity building. And also, whenever we are working with the local responders, we make sure that we co-create, for example, the policies together and the processes. We never impose Save the Children or HLA policies on anyone. We make sure that we are doing this in consultation with the local partners. So that's from the HLA side. So over to you, Rob.
Thank you. We will now open the floor to questions and answers and further discussion. And I see there are some questions already in the chat. One directly to the key findings about flexible funding. Bassam, I don't know if you want to address that right out of the door.
Yeah, sure. Just on that bit, basically we had two things. So when we spoke to organizations on the ground, they mentioned that the flexible funding was only available to very small grassroots organizations. And that's mainly because they work on a very small scale. So they basically raise funds locally, or they raise funds from diasporas. But when we took this finding, I wanted to see if there's already something out there happening in terms of flexible funding. And it was quite interesting because I think two organizations are leading what they call pre-positioned funding, or like seed funding that they give to local partners. Basically, this funding is kind of unrestricted. There are rules on how it's spent. So there has to be a committee. The local partner would basically decide to come up with an emergency project, and this committee would approve this project. So the funding would be available on the ground. There are rules on how it's spent. There has to be a committee. There has to be agreement. There has to be a pre-approval. But the two are actually mentioned in the report. So if you refer to the report, two organizations are doing this: Start Network and Türkiye. I hope that answers your question.
Thank you. The floor is now open. If there are any more questions, you're also welcome to post them in the chat if you don't want to raise your hand or take the word, but feel free to just raise the hand and comment and discuss this. Another question in the chat. Are we looking at arts-based capacity building too? For example, using applied theater to address social issues or to monitoring, evaluate impact. This, I feel, is a question more directed at HLA. I couldn't see any of those kinds of CB initiatives. Edur, you may want to comment on this.
Thank you, Rolf. So actually, we were discussing this issue, Osama. But we would also like to see in other contexts how this exactly happened. But it's like something that we are interested in. We have been discussing this recently. But it's really interesting to hear about it as well. I don't know, Nancy, do you like to add anything for this?
Yeah, maybe just to add that we have very specific area that we work in, as I said, CSF, technical expertise and leadership. However, I know a lot of these approaches are used for mental health and psychosocial support. So what we do is we also work in partnership. And if this is an area a huge need has been recognized, then we can work with partnership with people who provide this support. But it's not our core business. I hope that answers you, Osama.
Thank you. I have one question to HLA while we're on, because you mentioned coaching and mentoring, and it's also something I believe myself, that any capacity building initiatives needs to be followed up with more on-the-job coaching, mentoring, or training, if you like. Do you have any examples of how this has worked and that can be perhaps adapted to the context in Northwest Syria?
Yeah, thank you, Ralph. Actually, right now we are designing some programs for Libya response, where we are, first of all, working on delivering some workshops for the local Libyan organizations about topics that they identified as their priority. The two topics were crisis management and conflict resolution. So the program we are designing now, that after we finalize these trainings, these workshops, they will be followed by a component of coaching and mentoring, where we will match the local leaders with local coaches, and we will see what are the needs from their own leadership perspective. So we are rolling out this program in Libya, and you know, as a pilot, and if like it works, we can like follow up later on with the Syria response. Like we can adapt this more and more.
And I can also add, we have a whole pool globally of about 350 pro bono coaches. I know, especially if you think of the crisis like Sudan, where access was a huge issue, we are linking up different humanitarian leaders with coaches. So there's about 6 to 9 months. So that's also something that we include.
Thank you.
I think just to follow up quickly, I know that the report is really focusing on a specific context, but I'm pretty sure that there are a lot of similarities with other contexts. So I really, really recommend that you go to the report and see how it really applies to your context, because again, localization really is not context specific. And as I mentioned, like it's across all functions, across all levels. Even if you're a grassroots organization, what does that mean? What does localization mean for you? So for instance, from what we spoke about with some of the interviewees, basically, even if you're a locally led initiative, what does that mean? How can you empower communities to actually engage with the project design, so you can actually basically intervene in a way that really affects them positively and respond to their priorities. And this is one of the capacity strengthening needs that was actually highlighted, is how can we design co-created projects, or how can we create a truly participatory project that starts from the communities themselves. So yeah, just wanted to mention this because you mentioned Libya as well, which I'm sure there are a lot of similarities.
Yeah, it's one of the challenges of localization to break that circle of just being implementing partners and actually becoming the expression use equitable partner. So, there's another question in the chat there for you, Bassam, while you have the floor, about in terms of capacity sharing. From your perspective, are the local NGOs open to share their own strengths and give up on the competing approach? And what are the expected potential roles of the INGOs in that area?
Honestly, everyone I spoke to did not really like localization meant something about empowerment rather than replacement. So there was not like the mentioning of competition was actually between local NGOs themselves rather than INGOs. And what was highlighted is basically we need to improve the relationship across the board. So it was not really between INGOs and NGOs. It was the multi-layered aspect of it. Like even grassroots organizations, they feel very left out. They feel like they're taking the crumbs of whatever funding is available. So if you look at the different levels, I know that maybe you're working on a local NGO, but then it's also very important to reflect on your power and how you have the advantage over more local NGOs who actually think that they're also competing with you. So it's not really competition. I did not pick up any sense of a competing approach. It was more about how can we not change the system, but look at the system in a more collaborative way. INGOs have a very important role to play, and that was highlighted in the report. It was mentioned by all of the interviewees. I don't think, like even UN organizations, if again you read the report, the absence of the UN organization is a very, very negative thing that happened to these organizations, because they also have a very important role to play. And that was what was highlighted, really. You need to look at what INGOs are bringing into the interventions, what your organization is bringing to your intervention, and what are the local partners are bringing to the I don't know if I've answered your question, but feel free to follow up if you have any questions.
Yeah, and can I now also
Sure.
Yeah, sorry.
contribute to that? Yeah. So thank you for discussing it on a programmatic design and funding level. But what we've been able to do quite practically in a number of different contexts, similar but different, because it would probably be in a different region, is we've been convening learning spaces and think shops. And I can give an example of one learning space we convened, and we were able to have a donor representative there, local organizations there, and INGOs, and we were discussing actually what does capacity sharing mean in action. And you'll find that there was a lot of sharing because they were given that platform. So convening spaces like that, or we've convened things like think shops, where we're like, okay, this is the context we're working in. What are some of the solutions that we can come up with? And we'll do it jointly with the organizations. And another point maybe I can add is a very good entry point is working with networks, because the networks already have the buy-in of the local organizations, and using that as an entry point. So I think that has been quite useful. And one of the things that came up when we did the think shops, and we actually had a donor there, was for huge funding opportunities, because of the inability or limited ability for local organizations to absorb such funding. They were actually encouraged to come up with consortiums. So I think if we can also let local organizations come up in consortiums, and then they can have even access to slightly bigger funding. I hope that answers that.
Thank you, Nancy. There's another question in chat that I think we can discuss a bit, and it's there's a 10+ year crisis in Syria, and we still see the same capacity strengthening activities repeated. And does this mean we're not so far successful? For the first part of that question, yes, it's the same activities that are many times being repeated, and this is the business as usual. We need to break, I mentioned during the key findings that we're talking about finding initiatives that actually has an exit and handover vision, a strategy that lasts longer than a funding period of 12 months. That would be. I don't know, Bassam, if you know about anything about the capacity strengthening initiative that has been the last period and up until now, how successful they've been.
Thanks, Yusuf. Yes, it's a very valid, and that was the starting point really of this research. Like I've worked on the Syria humanitarian response, and I know that capacity building, strengthening, has been going on for a very long time. But at the same time, I think this research was providing something slightly not very dissimilar, but something very particular. Is we are identifying gaps in the capacity strengthening, and that meant that we need to speak to everyone, not just organizations in Turkey, but actually local responders as well. I did try to expand it to people who are managing the camps, for instance. So basically, yeah, like there is a lot of one of the findings is that, yeah, there is oversaturation of some capacity strengthening activities. And at the same time, there are gaps, which depends on the level of the operation of these organizations.
Thank you. There's another question also from Yusuf there about the, we have figures about the percentage of budgets for local actors other than the NGOs available in the chat. I do remember that we had some figures in the report that exemplified the imbalance, but I don't have them on top of my head. I don't know if you, Bassam, who held the pen on, found this, know it?
Yeah, same. Like, again, I was part of that research, local to global, ever since 2015. And yes, it's mentioned in the report. I really, really encourage you to read it because, again, that was the starting point of this research. So I really did my best not to create something that has already been covered or like is already out there. Quite the contrary, really. I started from whatever is existing and tried to expand on it with the limited resources that I had. I don't know if others have any.
Yeah, there's one here, but this research focuses very much on a localized approach, and there's another question here about the involvement of UN and the big donors on the strategy side of this. Did you come across any of the findings that talk to that?
Sorry, Rolf, was this for me?
Yeah, yes.
Did you? Sorry, I didn't hear your question.
No, it's we focus this analysis very much on a localized approach, but there is the role of UN agencies and donors in localization as well. And did you come across any of findings on how they're involved in this question?
Yeah, sure. And again, like I try to be very inclusive and try to like include all of the point of views really. And I think one of the gaps was actually, yeah, again, what does localization mean to different actors? And the majority were like localization means if I'm working with a local organization. But that wasn't enough when I was speaking to people on the ground because they were like, which local organization at which level? Because it differs. Like if you're a representative office in Turkey, that's entirely different if you are a local actor actually on the ground. So that was, yeah, again, one of the findings is that what does localization means? Which level do we need to work with? And this is especially because the context of Northwest Syria is very, very specific, where like the interventions are actually done through a very multi-layered process where the funding goes to a different organization and it's channeled all the way to the ground.
Yeah, you use the word that it's like a hierarchy, and that I believe those who are on the bottom of that hierarchy are those who benefit the least of the,
Yes.
and that is something that we need to work on, and it's part of the challenges that was identified. Another last question again. One of the key factors behind slow progress towards localization in Northwest Syria, non-state armed groups. Are there any capacity strengthening activities with this influential actor in Northwest Syria, for instance, awareness about localization, international humanitarian law, and their impact on localization? It's I see the importance of this, but I don't know if you have an opinion on this, Bassam. You know the context best.
I think that's out of the scope, but it's a very valid point.
It's
And
out
it
of
really
the scope,
doesn't,
but it's an interesting point, and nevertheless.
yeah, and it doesn't really affect just capacity building, it's also funding. So I'm fully aware of this. And it really hampers the work that local organizations are doing. But again, this is why it's really important to have equitable partnerships and not just partnerships. To basically rely on pre-existing capacities rather than replicating ones. Yeah, and again, it's a more than 12 years response. So some of these organizations have been working for a very long time and they're vetted and everything. But yeah, the challenge still pre-exists. The due diligence is a big issue when it comes to funding and localization.
And just to repeat that, the scope of this research focus very much on the humanitarian analysis and humanitarian capacity strengthening needs, because that's our scope and that's the framework that we work in. Being mindful of times, we have 4 minutes left of what was set aside for this webinar. So if there's any last questions, we can address these or be adjourned. at the chat or if there's any hands up. There is nothing further to see in the chat, so then I'll just use the last opportunities to thank Hassan for his hard work, and Nancy from Humanitarian Leadership Academy for having contributed to the solutions and to the analysis of this, and also to those who have been helping out with this webinar, Daniel and Ruth, for having helped up to make it run smoothly. So thank you, everyone, and adjourned. Thank you.
Thank you all.
Thank you all.
Thank you.
Have a good rest of the day. Bye.
Thank you.